We're here once more at Total Health Chiropractic, learning about the wonders, really, that Dr. Miller and his DRX 9000 can do. Maybe for you, that chronic and neck back pain. Lonnie, he's from Rockford, and you were suffering from some of this stuff. Let's talk a little bit about why you came to Total Health Chiropractic.
Well, the reason I came, I saw the doctor on TV, and I saw the messages he was relaying at the time. And at that time, my wife had back issues.
Okay.
So she went through the injections hoping to get better. That didn't work, or worked for a short time. And then she had surgery. That was all right for a period of time, and then it wasn't. So then she had a second surgery, and that too worked for a while, and then it didn't. So that was a reason when I saw the doctor on TV, I decided, well, I'm not going to go with that route. I'm going to try something different, so I won't have to go through all the surgeries.
So really this was spurred on by your wife's issues, but then you started having trouble too.
Oh, yes, I did. And then, so I would go see a chiropractor, not this doctor, and then it would work for a short period of time, but still the pain was there and never left. So I remembered the advertisement on TV, so that prompted me to call, set up a schedule or appointment, came, and rest is history.
Dr. Miller, is that something you commonly hear? Somebody's gone through injections, they've gone through surgery, sometimes multiple surgeries, or tried other chiropractors and they're just not seeing the relief?
Yeah, and Todd, that's a common approach that's recommended to patients. You know, it could be medications and physical therapy, shots, surgery, and a lot of people are scared about that. You know, they all have side effects, high risks with some of those. And so, you know, we just get a lot of patients coming in that want a natural solution and want to actually work on fixing the problem, not just masking symptoms temporarily.
And what back problems were you having, Lonnie? What was the specific issue?
Lower back problems. I had sciatica, nerve issues, so yeah, and that was not getting any better. And that's what started out with my wife. And I just didn't want to go that route.
What was it doing for your daily life? What was it keeping you from? Well,
I couldn't do all the RVing and the other exercises. Couldn't be horseback riding like I used to doing and all that other stuff. Yeah, it limited what I could do physically.
Okay. And when Lonnie came in, Dr. Miller, what did you find?
Well, I always remember he said, I'm looking for a solution, not a Band-Aid. That's what I've gotten so far. And so, you know, we consulted, we did an exam on his back and legs, took some x-rays, and, you know, unfortunately, looking at the x-rays, he had essentially bone-on-bone degenerative disc disease in his lower back. And so he was a great candidate for DRX therapy and got him into the program. And like you said, the rest is history. He's doing great, walking around and living the life he wants to live.
When it comes to the actual process itself of the DRX 9000, for somebody who maybe hasn't heard of that before, what is that like?
Oh, it was simple. I mean, it was just a matter of laying, being, well, basically strapped to the machine, let the machine do what it's supposed to. After the first time, I mean, what a relief. By the second time, I was not having any issues again. And then the rest just got better.
Wow. So you felt relief after the first treatment?
Oh, yes.
And so degenerative disc disease, for those who don't know, those cushions that are in between you're in your spinal column, that pretty much makes your spine.
Yeah, Todd, even on the model, these are the bones, the whiter colored pieces. The discs are here between, and they're a shock absorber. They're a spacer for these nerves, very similar to a moist sponge. And so when they degenerate, it's because they're drying out and they shrink down in height and encroaches on the nerves. It gets very brittle and hard, so it can be tough to walk or do activities because you don't have that shock absorption anymore. But with DRX therapy, we're able to draw herniations in, draw moisture, nutrients into those discs. So almost like a dried sponge that gets wet again, it creates space for the nerves and has that cushion so that people can live an active life without pain. Again, it's because we're getting their spine and discs healthier, not just temporarily masking symptoms.
Very, very specific, laser-focused treatment. What's life like today? Got big plans? Going horseback riding?
Yeah, oh, heavens, yes. That, of course, jeeping.
So you got the Jeep out, plans to get out and back on the horse and feeling no pain.
Yep.
That's the story we want for you as well. Check them out today. There is a new patient special that will have all the information for you on the screen. Or you can just call right here, Total Health Chiropractic, and get that relief you've been looking for.